Good evening and welcome to the 87th session of ICC Crack the Wellness Code. I'm Somnath Chatterjee, co-founder, executive director, and welcoming you to another session of Skin. This is the second session. We had the first one on October 29, and we're going to be having more focus on specific skin ailments, preventives, and therapeutics. And of course, a very, very engaging question answer session follows after that. These are the learning objectives you can see on the screen. We'll revisit very quickly some of the things we covered last time. And then Dr. Sunil Dhawan, our guest speaker and the expert, is going to be focusing on some of these things that you can already see as highlights on the screen. This is the agenda entirely centered on Dr. Sunil Dhawan, whom you had really enjoyed interacting with last time. And this is, of course, the disclaimer. We certainly want to let you know that while we help, we advise, we provide a platform, but this is not a doctor-patient relationship platform. So that's something which you need to do on your own. We can help and guide, but this is not typically that platform. And of course, we really want to educate the community worldwide with these programs, and some of it, of course, get recorded and we use for educational purpose. So I take pleasure in introducing to you Dr. Sunil Dhawan. You can see his distinguished background. Okay, so he's also been teaching at Stanford University School of Medicine since 1992, and of course he's an entrepreneur. He's been running this clinic for several years, located both in Fremont and Milpitas, and he has mastered a very vast territory of skin, which you can get to know very soon. So over to you, Dr. Dhawan. I would now just set the stage for you to take over.
Yeah, we'll cover all the topics that were listed: acne, some skin basics of skin, eczema, other things. So specific skin ailments, preventatives, therapeutics. Talk about acne. The first three are actually the same subject. Actually, the first four are the same subject. So that's all combined. Part one, it's skin functions for protection, temperature regulation, sensation, and acne or pimples occurs in over 35 million people from ages 8 to 50. Usually clears by 18 to 20, but not always. And can persist in later years, especially in women. Flares with hormone changes during the menstrual cycle. Its causes are blockage of the oil glands. There is a bacteria that may be involved with it, the action of hormones on the oil gland and the skin. All three of these combined cause inflammation, and then you get pimples, and then in people from India and the subcontinent area, they tend to hyperpigment and scar quite easily, especially younger individuals and women as well. Occurs in the oily portion of the face, upper back, chest, and upper arms. Can occur on the thighs and the abdomen as well. This is the normal unit. You can see A is the canal, B is the gland, so it's called the sebaceous gland. C is where the bacteria resides, and D and E are the first two layers of skin. The problem is in that canal, it gets all blocked up, and no cleanser, no agent really other than certain things can get down there to unblock the gland, so unblock that canal. So that's the key. So washing your face successively will not make acne better. These are comedones. That's the first signs of acne. Those are little bumps underneath the skin. You can see some of them have become inflamed and formed pimples. The little white bumps you see, they're called blackheads or whiteheads. They're underneath the skin. They're like little fine grainy bumps. That's a blackhead. That's in somebody older with sun damage, but that's essentially a whitehead and a blackhead are the same process. A blackhead is just an open whitehead. It's just the blockage of that canal creates this mass of oil, and that creates this bump. And the bump is either open or closed. And if it's open, it's dark. The top is dark because of the oxidation from the air of the oil that's in underneath the skin. Here are a bunch of blackheads and whiteheads or comedones on the chin of a woman there. Very common area to get it. Very hormonal. This is where the layers of acne can occur. Then if those blackheads and whiteheads become inflamed and form pimples, you can see little bumps on the nose here. That's the precursors. And they become red and inflamed. And can also leave some scars that you can start to see. That's the inflammation. And when people pick at them, squeeze them, do stuff to them, they become very inflamed, more inflamed, and then they can leave scars. And you can see the little white, go back for just a second. If you look in the middle of all those red guys, there's a couple of little holes. That's a blackhead. So the blackheads, when it becomes inflamed, become formed a pimple. This is more severe. The jawline can leave scars. It can be difficult to get rid of the marks. You see some pigmentation and some redness. And then you have a lot of scarring on the back. It's not very easy to treat, difficult to make better. So there's some more scarring on the face because of all the pimples that were not treated, or this may be even treated, but a bit late. So this is someone who's been treated. You can see all the scaling from the medications. It's quite dry. It's been left with flat red scars, which are not that difficult. So there's topical medications to open up the oil glands: Retin-A or tretinoin, Differin or Dapiline, and Tazorac or Tazarotene. These are the three main ones. Now there's a couple of new ones. One's called Aclief that's come out. It's quite good. And you can use topical anti-inflammatories like benzoyl peroxide, Clearasil, Proactive, prescription versions, clindamycin, erythromycin, and combination products. These are old but effective. Proactive is just Clearasil, just more expensive. And we can also do oral antibiotics, Accutane, birth control pills, and minor procedures. We also do something called spironolactone, which is a male hormone blocker, and several new creams are coming out that block the action of male hormones on the oil glands. So there's lots of new stuff coming. This is an old slide about outsourcing, when people were outsourcing a lot of work in India, about the homework being outsourced to India. Can't be done. So here's a baseline person from an Accutane study that was done many, many years ago. We do a lot of clinical trials in our practice, and I've done 2 Accutane trials to get the products approved in the United States. Actually owned by an Indian company now. And this is after 3 months after 1 course of Accutane. Dramatic results. People have trouble with Accutane in that they get all scared with it. Not really anything to be scared of if managed correctly. It has to be managed, in a correct way. So we've got to, make sure that people are managed, and you can see that they're taken care of correctly, and then they do well. I see several patients from India who've been unmanaged in India, meaning they were given medicine without monitoring, which is a big problem. And from China as well. Acne star treatment, microdermabrasion, dermal grafting, which is what we do a lot of. I'm doing 2 cases this week. And then we have laser treatments. We do a lot of work afterwards, which is not a lot of people like to do. So acne scars are unforgiving. And once you get them, they're hard to treat. But if you feel the need that we need to help you and you need to get help, we're happy to help you get better. But you have to find somebody who's enthusiastic about doing it. Pigment spots. They're small, flat ones. They're called lentigos. They're related to aging and sun exposure almost exclusively. They're not liver spots. They're not from the liver. They have nothing to do with the liver. You can also get small bumps on the face and neck. They're called DPNs, skin tags, related to aging, sun exposure, and weight. Genetics, actually. One thing I forgot to put was genetics. So many people have them in their families, and they're like little hanging pieces of skin. They occur in women after childbirth. They occur on the body. They occur on areas underneath the breast, underneath the arms, on the neck, folds. And then finally, we have patches, which is melasma. Difficult to treat, not easy in some women. Some women respond beautifully. Related to sun exposure, estrogen, pregnancy, and heat. Genetics as well. So often mothers and daughters and granddaughters will all have a similar issue. Or the mask of pregnancy that occurs on the cheeks. These are lentigos. It's in the back of the hand. These are brown spots, much more common in people who are more fair skinned, but do occur in darker skinned individuals as well who've had a lot of sun exposure, especially those who are, say, farmers or people outside a lot. This is not a great photo, but these are some more lentigos. It's kind of a little too wide, but yeah, these are brown spots from the sun. You see the arm and the chest. These are skin tags. These are kind of the relatives of the flat brown spots. They're related in some patients. These often occur more though with weight on the underarms, groin, neck. Very common. They're hanging. They're called hanging skin. Very easy to remove. We probably do 1 or 2 patients every day. These are the flat versions. They're called Dermatosis, Papillosis, Nigra. They're very common. Weight related, genetics, occur more in women. Bothers a lot of women on the cheeks. After pregnancy, they get tons of these. Treatment. We can laser or freeze or cauterize some of the small spots. We use fading creams, microdermabrasion and peels, and laser for the brown patches and more of the brown kind of diffuse spots or diffuse patches. So here's somebody with melasma. This is the patches of pregnancy or patches in women who are on estrogens. Quite common. You see it a lot in the Indian population. Not easy to treat. Sometimes difficult, sometimes very easy, but not consistently easy. This is before and after. This is a moderate to mild transition. These are good results. I'd say probably about 40 to 50% of people that we see achieve these results. But 50% do not. That means that they're harder to get clear after 8 weeks than this one was. And you can see she's more fair skinned. Fair skinned people have it easier. Again, lighter, but not completely gone, but lighter. Still see some patches of brown, but not as much. Somebody of Asian background, patches there, less patches. Still brown, flat spots, which are more responsive to laser, but the general brown discoloration is much less. They say cleared. I think I can still see a little bit of brown, but for the most part, pretty good. Warts are a virus, very common and infectious. Treating with freezing with liquid nitrogen, surgery, certain injections and creams. Need multiple treatments. Once you get 1, then you'll get 5, then you get 20. So you want to treat 1, urgently. You don't want to wait and think you can use stuff at home. You can. The home-based freezing doesn't do anything much, but the home-based salicylic acid creams work fine. And if you're consistent and persistent, you'll get better. Most people are inconsistent and never persistent. And then they complain that things don't work. Well, but it doesn't work because you don't brush your teeth once in your life, you brush it every day. So you have to add this into your schedule if you want to. That's a wart on the top of a finger. It's an infection. You got it from somebody else. There's warts on the bottom of the feet, which can be quite painful. It's the Doctor's Hall of Fame. I hope to have to be in there someday. Somebody gave me this and I put it in as a slide. Eczema. Very common in the Indian population. Today I saw 3 children, all East Indian background, 2 new patients with eczema. Very common. It's also called atopic dermatitis, chronic, long-lasting condition. Immune cells in the skin overreact. Skin becomes itchy, dry, inflamed, and scaly. There's no cure for eczema. We can get people under good control if they're managed correctly. And that's the thing. Management is the. So how does eczema differ from other skin conditions? There's something called contact eczema. It's a rash similar to regular eczema, but caused by contact with an irritant. No family history of eczema, asthma, or allergies in these patients. Normally, they just are allergic to something they get in contact with, like hands, excessive cleansing, which is happening a lot now with COVID. Psoriasis. Localized patches often on the elbows, scalp, buttocks, and the backs of the knees. The front of the knees. That's incorrect. Front of the knees. And it also gives you pitted nails and patches on the scalp. That's very, very common. Eczema in the general population affects about 15 million people, 10% of all infants, probably 50%, and that's probably a low number, of all Indian background children in this country have had it. Incidence is increasing, doubling over each of the past few decades. That may be because we're too clean, spend too much time in the shower, do too much bathing. I'll teach you some proper bathing techniques. 80% of cases appear before age 5. 40 to 60% of patients still have some symptoms as adults. About 80% of patients also have asthma and or allergies. Strong genetic link among families, a family history of atopy, which is allergic diseases like asthma, allergies, and atopic dermatitis, in 70% of eczema patients. Itchiness, inflammation, redness, scaling, weeping or oozing, skin thickening and hardening, crusting, and secondary skin infections. So on the face, on the legs, it starts on the face, the arms, the elbows, and the knees in younger children and infants. And then it goes into the arms and behind the knees, the wrists, the ankles, creases of the elbows. Certain allergens, such certain foods and irritants, can make it worse. Climate, emotions. When people get stressed, they tend to flare more. Peanut butter, maybe. Food triggers are only occur in about 5% of people. Reduce household allergens, keep carpets and clothing clean and free of pet dander, dust, wear 100% cotton clothing washed with mild detergent, avoid bleach and fabric softeners. Practice healthy bathing and moisturizing habits. Lukewarm, non-soapy water, lightly pat dry, use a thick moisturizer. Use soap essentially only on the hairy area. That's true as for adults with eczema too. Scalp, face, underarms, and groin. That's it. Try to limit your stress and anxiety, and important for preventing and reducing flare-ups, but not in of itself enough to clear eczema. So you'll get somewhat better, but you'll never clear with just these things. But proper bathing, another good thing that you can do on weekends with eczema children and eczema adults, is a 30-minute soaking bath with 2-3 tablespoons of bleach. The other thing that I like to use a lot is coconut oil massage for the child. Massage them like grandma does, and put them in the sunlight, because sunlight and coconut oil are natural anti-inflammatories. You need to use a thick, creamy, oil-based moisturizer, Vaseline. You don't like Vaseline, shea butter, coconut oil. I like ghee. Ghee works great. Crisco works wonderfully, but it smells, so people don't like it. Most effective when used immediately after bathing. Apply throughout the day whenever skin feels dry. You want to use a cream, not a lotion. And Vaseline ointment is the best. Not effective for moderate or severe eczema if used alone. Helpful when used with other treatments. You always can put the moisturizer over everything. Treatments, you can do tar treatments. They're anti-inflammatory. They are a little bit odorous and stain clothes. Used mainly at bedtime. Light treatments, very effective. Used successfully for chronic severe disease, require multiple office visits. Potential risk for skin cancer with long-term use. That's actually not correct anymore. It's an old slide. Now we use a type of light treatment that doesn't have that risk. It's very safe. It's called narrow band. So no one uses wide band anymore. It's all narrow band, one wavelength. That has never been shown to cause a problem. Antihistamines are prescribed for itching, may not be effective. Sedative effects may provide relief when used at bedtime. So these are Allegra or hydroxyzine, things that give some relief. Antibiotics. Cracked skin due to itching often becomes infected. Antibiotics are effective in treating the infection. Antibiotics do not treat eczema. They're only used when you need them, not continuously. Topical steroids, best available eczema treatment for 40 years, range from super high to low potency. Effective, but may have many side effects if overused incorrectly. Okay? Everyone has this bugaboo with using steroids. Yes, if you take it orally or use high potency for many weeks or months. And recently a study was done that even if people overuse it, they still don't have a significant negative effect. However, when people stop them, they tend to flare back up again because they stop them all of a sudden. So people say, well, I have a steroid dependent eczema. Not quite. Your eczema was controlled and then you went off medicine too quickly. We're also looking for non-steroid creams now, kind of for long-term maintenance. But that's important that you know that low potency steroids for long-term use are safe, and I don't have a problem. So limitations. High potency should not be used on the face, groin, or armpits on children younger than 12, unless well controlled, for longer than 2 consecutive weeks. You can use it up to 4, but 2 is usually a good number to stop. Low potency is effective for mild cases, less risk of side effects like thinning of the skin, but may not be as effective in controlling it. Oral steroids are usually used after topicals fail, used in adults, affects the entire body, not just the skin with eczema. Side effects, long-term use, I'm talking about 2-3 months of use, not 2 weeks. It's high blood pressure, weight gain, loss of bone density. Topical immune modulators work a new type of eczema treatment, work in a different way than steroids. First new treatment in more than 40 to 50 years. Tacrolimus, Pimecrolimus, and Eucrisa are the 3. People who Google Tacrolimus and Pimecrolimus will see that it's got a black box warning. Well, the black box warning was generated by people who didn't know what they were doing. If you look at the data closely, which nobody ever does, they look at the black box and they all freak out. If you look at the data, it was flawed. It took rats and exposed them to sunlight for like 20 hours a day for a year. Well, the average lifespan of a rat is only a year or two anyway. So that's half the life of a rat. And if you do that, they do develop skin cancers if you use Tacrolimus, Pimecrolimus on them. However, the control rats who also had Vaseline put on them also develop skin cancer. So it's a flawed study. The FDA mandated it to check for skin cancer risk. And if you, these rats that were used have a disposition to getting skin cancer anyway. So even if you don't expose them to much sun, they get it anyway. So it was a mistake. Our national organization asked for it to be taken off, and they didn't do it. And a recent study was done tracking the use of Tacrolimus and Pimecrolimus since the year 2000. That's almost like 18 years, and there's been no increased risk of anything. So I want to get that idea out of people's minds and throw it in the garbage. Anyway, Eucrisa is the newest one. It does not have any black box warning, but I don't think the others need it either. Eczema disease process. During an eczema flare-up, it is believed that the immune system goes into overdrive when a person comes in contact with certain triggers. The immune cells are overproduced, which causes a flare-up. Topical immune modulators and corticosteroids reduce the effect of these cells and the inflammatory chemicals that they produce. That's the principle. Very exciting time in new eczema therapy. Dupixent is out. It's a systemic agent for bad eczema, works beautifully. I did the study to get it approved in the United States. I'm doing a study with 5 other injectables and new non-steroid creams. So we're looking at non-steroid options. There's 2 companies with amazingly good creams that I think will make a big difference. 3 actually. So this is a kid who took Tacrolimus. You can see eczema around the eyes and around the mouth. And after about 2 to 4 weeks, good reduction in eczema. Anyway, thanks for attending. We're the largest clinical trial site for skin disease in Northern California. Contact the CWC at events for engaging in these studies.
So thanks, Dr. Dhawan. That was a great exposition. Questions are pouring in. So let's start with this. The first one, this is a very brief one. And in case the person asking the question wants to speak, please raise your hand. We can do that. What is being said is white patches on the face. What is the solution for that? White patches on the face. What's the solution for
that? So white patches on the face could be vitiligo, could be post-inflammatory hypopigmentation, could be congenital Papillosis alba. There's multiple treatments. It depends on what you have. The one common thing you can use is Tacrolimus. It works beautifully in pigmenting skin as well, but very difficult to tell. I mean, white patches could be, what's the condition called vitiligo. That's what most people attribute to white patches. But white faint patches in children is a relative of eczema, so that's different. But Tacrolimus, moisturization, and sunscreen are helpful in anybody with any kind of lighter skin.
So the next one is basically a problem with eczema, and saying I'm constantly getting some kind of eczema under my left arm, which is itchy at times. How can I treat this with topical creams? Is it due to some kind of allergy?
If it's localized to one area, it's often suggested that you're allergic to the antiperspirant or deodorant you're using. That's usually the most common reason in a localized area underneath the arms. So you need to cut back the use to, don't use deodorant or antiperspirant for at least a month. And when you restart after everything's clear, you should use an antiperspirant without perfume called Sure Unscented. Get it on Amazon or at Target for about $1.98. It's the one I use because it has no perfume in it. You want to use something to clear it, and then don't stop using it for at least a week or 2 after it's clear. Use it, and boom, stop when it's maybe after 2 or 3 weeks. So yeah, whatever they give you, wherever you've seen, should tell you to gradually taper it off. And once you get eczema in that area, even if it's from a contact allergy, then you need to gradually, you can have recurrent flare-ups for weeks and months afterwards. Because once the skin gets injured by what you've been doing to it, it can persistently keep going. There was a question that popped up right now with some natural treatments.
Yeah, so let me go to a slightly different question on the screen. Why do I always get flaky skin in the T-zone areas? That keeps bothering me mostly on my nose area and the temple area. And the person says that tried many creams, it does not go away. Even tried coconut oil with alleviatives and so on. It just leaves that oily surface, but doesn't really cure.
Because you have a condition called seborrheic dermatitis. You don't have eczema. You have a variant of eczema, but it's not really eczema. That's why it doesn't go away.
Okay.
So it's an over immune reaction to a normal fungus that lives on everybody's skin. Yours is just overactive. And it's more common in drier climates. So when it happens on the face, the nose, the forehead, the brows, the scalp, behind the ears, on the top of the ears, sometimes in the middle of the chest, sometimes in the groin area, sometimes underneath the breast, sometimes underneath the arms. It's a relative of psoriasis. Common thing that you can do that works is you can take over-the-counter clotrimazole, which is an antifungal, and 1% hydrocortisone, which is very weak, doesn't cause thinning, doesn't cause anything. It's been out over-the-counter for probably 30 years. Used in babies a lot. It's very safe. You put that, you mix them 50-50, so you make it even weaker, and you use it as an anti-inflammatory, anti-fungal, and it works very nicely. Gets people under good control. Next.
So the next question is regarding practice. So it says that a lot of dermatologists use steroids very often not informing. Is it a practice to inform the patient while giving steroids? What's the normal practice?
Well, can I be very blunt? I can be very blunt. I saw 2 or 3 people today. I repeated everything I said, and yet they didn't understand. They didn't write down anything I said about what they were doing. So the practice is, yes, we tell people, but most people are not listening. Most people are on their phones. They're worried about their home. They're worried about their job. They're not listening. So I have to repeat myself, and I have to write it down. And even then, when I write it down and tell them to look it up, they still haven't looked it up half the time because they're too busy. They have too many things going on. So yes, we do usually tell people that, yes, you're using a topical steroid, you're using a mid-potency, a high-potency, low-potency. We try to tell them, but most people are not focused when they're in the office setting. They're worried about too many things. We have to focus them down. Yeah. And yes, you should definitely ask. And if somebody forgets, if I forget, ask us. Because we're human too. We're not going to be able to remember everything. But also when somebody's telling you something and they say, go look it up, it's your job to look it up. I hand out website sheets all day, and I'd say the hit rate is somewhere around 20% of people actually do what I tell them. So the complaint that patients have of not getting information, at least from us, is difficult for me to understand. So I write it down. So about 10% of patients leave the sheet of paper on the desk at the front when they leave, which means they don't even remember to pick it up. So when you're in an office, you need to bring a sheet of paper or something, or take a sheet of paper from us and write it down. I force people to type it in their phone. They say, well, why did you write it out or give me a summary? I said, because you're not going to learn it. I'll learn it, but you won't learn it. So the best way for you to learn is to type it in your phone. Get that phone out and start typing, because that's the only way you'll learn. Or bring a computer. You'll learn so much when you type it. You'll get into the flow of learning how to do things. And then, yes, and absolutely we should be giving you information, but you should read it. So if people aren't giving you information, you got to get out of there, because that's not what you're there for.
So it needs to be a collaborative engagement.
Absolutely. It has to be it's a two-way street. Absolutely.
You have to take charge of your health.
Yes, absolutely. And I agree, doctors don't do that. I absolutely agree. But boy, when you're in my office, you get 3-4 sheets of paper. If you don't read them, it's your problem, because you're supposed to do it. So I'm supposed to give it to you. You're supposed to read it. So I want you to be educated, because that way you'll do a much better job. You'll get better because you'll be compliant. And the one thing I've noticed is that phone, everyone has it. No one ever loses it. Pieces of paper fly all over the place. Phone, they never lose. Never. They would be dead when they lose that phone. So I love the phone. I think it's a great device. Anyway, go ahead.
So they need to embed some more valuable tips from the phone. Then the phone becomes more, right?
Or the other thing I tell people is record what I'm saying. Take the phone is there, record it, and go home, transcribe it, read it, think about it, and then call us back with questions, or you can even send us e-messages. We have a portal. There's all sorts of stuff. No, we want people to be compliant. Compliance is directly proportionate to how much you read about what you have. So, anyway.
Yeah, so in some, basically, it's basically informed, but it's
Yes,
also important that you do this as a collaborative engagement, and
absolutely,
also make sure that you ask those questions which really
absolutely.
matters to your health, right?
Absolutely. And so the other thing that I've started doing a lot is I will ask, especially my engineering patients, because they have a lot of questions. They're very smart, much smarter than sometimes even I. They know a lot of stuff. So they'll say, so I record at least 6 times with every patient, new patient at least, not the old ones. The old ones know my style. The new patients, I said, do you have a question? Do you have a question? So I 6 times try to ask them, do you have a question? And up to the fourth time, many of them say, oh, no, I don't have any questions. The fifth time I ask, wait a minute, I have a question. The time the question comes out. So it's getting the questions out there. So I said, get it out, man. Otherwise, you'll never learn anything.
Yeah, yeah.
And so and I said, write it down. That's another one. It's very important.
So,
But yes.
Dr. Dhawan, we come to a slightly different topic this time.
Yes.
This one is the hair fall also related to skin problems, and how can we prevent hair fall?
So hair fall could be male pattern. It could be a condition called telogen effluvium. It could be from chemotherapy. It could be from meds. It's so widespread ranging that it's very difficult to just say, give you one answer. One answer is very difficult. But the common things in women, especially South Indian women, about 40 to 50% of all South Indian women have a condition called telogen effluvium, where their cycle is faster and they lose 3 times the normal amount of hair, but they don't get much thinner because the cycle is faster. Everything's running faster, but and they'll notice their ponytails are smaller, and they lose a little bit of hair in the temple areas, but the center of their scalp still has a lot of hair. So it's just a condition where the cycle is faster. Then there's also something called female pattern thinning, which is quite common in women, maybe related to a sensitivity to male hormones. There's a whole range of things that can be done. This requires almost a full lecture itself. So we can certainly talk about it at a later time. Next.
Are over-the-counter skin tag removers effective?
Usually not, but you can try them. Usually they don't do a lot. I mean, some of them I think have an electrical current. Some of them are freezing devices, but they don't make them very powerful because if they made them powerful, people would freeze their eyes. And then there'd be lots of issues. And that's why liquid nitrogen is kept with us, because people have a tendency to abuse it. So not usually, but they can. I think some of them do work, but it's not consistent. That's the problem.
Okay, so like you have this, a periodic eye check and dental check and so on. Is there some sort of a sort of cycle or some sort of process by which one should actually visit a dermatologist once a year or once in 6 months? Is there something like that? Is it necessary?
Only for fair-skinned people who've had a lot of sun damage. Those are the skin cancer risk people. The people who are not fair-skinned or have a lot of sun damage have been indoors a lot of our engineering friends basically were indoors most of their lives, so they were studying and they're working indoors. It's unlikely they have a problem, but most of them still need to wear sunscreen and stay out of the sun, but they're okay unless they have most of them come and see me once or twice a year for refills and to go over what they're doing. And I'll look at their skin, but most of the time it's very limited because they're protected. They never had a huge amount of sun damage. So most of them are good.
So does applying expired sunscreen cause eczema?
No, it just doesn't work. But usually, you can be allergic to sunscreen, but it doesn't have to be expired. It can be expired or non-expired, but even expired stuff you can be allergic to.
The other one is, does castor oil help in nourishing the skin and also removing dark circles to some extent?
Doesn't do anything with dark circles. The best moisturizer that's natural is coconut oil.
Coconut oil. Okay, yeah, that's.
I think I was born in South India in my previous life. I love coconut oil.
Okay, yeah, you mentioned that last time as well.
Yeah, it's coconut oil, mustard oil, almond oil. Those are all good. The other oils are probably fine, but the only studies that have been done, and again, I bring up this concept of studies, and people hate this. because they say, well, I heard it on the internet, or my cousin had this happen. And I go, well, you know what? That's anecdotal. I don't believe it. And what I want all of the people in the audience, many of them are very highly educated, PhDs, very advanced degrees and from great institutions. Start thinking like a scientist. Start thinking like with data, and start looking. Many of you are data scientists. Start looking at the data and look at it and say, does this really make sense? So the data on coconut oil is strong, and some of the natural ingredients are moderately strong. Some of it has no basis in fact. Nobody has ever studied
So
it.
if you're doing a data-driven analytics, number one is coconut, followed by mustard and almond. Is that what you would say?
Mustard and almond less supported, but definitely coconut. Coconut is better. Coconut oil and oral fish oil is excellent for people with eczema. And for the vegetarians, it's omega-3.
Yeah.
So if you do that, that's supported by many, many studies that show that it has benefits. All my eczema adult patients, I tell them to be on fish oil or omega-3s, also for their heart.
Yeah, so the next one is, please suggest some natural remedies for dandruff in the scalp.
I mean, again, oils are helpful in other oils that I've mentioned. Frequent washing of the hair does not make you lose more hair. So any natural shampoo that you like, but remember, no shampoo is really natural. It has even Chicakai and all the natural brands. If you look at them, they're about half of them are unnatural. So if I could give you a natural shampoo, there is none. There's nothing that cleans completely and gets that oil and flakes out of there. I mean, if you want to use just a basic soap, you can. That works just fine. And then you want to moisturize it like the night before and then wash it out. A natural anti-inflammatory that works on flaking really isn't a lot out there. I mean, I'm actually working up a lecture on natural treatments, and for flakiness of the scalp, I haven't found too much that actually studies supported. I mean, none of the shampoos that are good for dandruff really have any danger. I mean, if you want to use a zinc-based shampoo, that's probably fine. It's only in contact with your skin for only maybe 3 minutes. It's not even going to get in. It's just not going to do it. So most of the fear of zinc-based stuff or selenium sulfide, you just have to really eat it for it to be a problem. It's just in contact with your skin for limited amounts of time. But a regular shampoo, I think clear shampoos work pretty well. They're low in preservatives. DHS Clear is a good clear shampoo, but it doesn't have a great anti-flaking effect. But if you do it every day, it probably helps.
Is Dysonite safe to use?
Very. Limited use, controlled, absolutely, it's very safe. It's double the strength of over-the-counter hydrocortisone, so it's pretty weak. But controlled. You don't want to use it in babies for 7 or 8 months. You can do that in babies, but you have to be careful and maybe stop it for a while or cut it down to weekends, that kind of stuff. I mean, I actually will check little kids for growth suppression and other things when they're using these things. Sometimes I'm forced to use them. I don't like it, but I have to use it. And I haven't found a negative effect yet.
So this one is a query which says that a fairly large area, approximately 3 inch by 2 inch, black in color, the back of the back and below the elbow. What could that be?
Again, it's like saying that I have a red car. It could be a red Toyota, a red Honda, or red Pontiac. So no, but I'll give you some general ideas.
Yeah.
So discolored skin in brown people, mostly Indian, tends to be something called post-inflammation pigment. And some of the common things that do this are post-eczema in adults, you get brown patches. Post-acne in adults, you get brownness on the face. Post-acne on the back, you get brownness. There's also a condition that's common in the Indian population. I see probably one patient every other day with this. It's called Lichen Planus. It's an autoimmune condition that hyperpigments like crazy. And there's a variant that gives you pigmentation on the neck and the back. It's a very hyperpigmenting variant, and I'm seeing an explosion of cases of this. And it's very autoimmune. So that could be that. So post-inflammation pigment, It could be, and that's usually after an immune or autoimmune or not even eczema or acne. Those are the most common things that give you this post-inflammation pigment. And lichen planus is another condition that does.
This is a new, area of problem that, with regard to nails, seems like, fungus and thickening of nails, both hands and feet. So what does one do?
Well, I mean, if it's truly fungus, it'll occur underneath the nails. You get flaking and elevation of the nail plate. It's a problem of the skin underneath the nail, not the nail sore by itself. What do? If you catch it early, you clip the nail back and use an antifungal. But ultimately, you may need something oral called terbinafine, which works actually quite well.
Let's go to the next one. If blackhead is removed, does it leave a scar?
No, if it's extracted correctly, it has to be extracted. If it's extracted incorrectly, it could, but it's rare. Most of the time, when people try to extract them, they push down on it. You have to make a little opening so that the thing can pop out. So it has to be kind of nicked to get it out as we've done cleaning.
Yeah. Okay. So the next one is what habits should we adopt, and what kind of changes should we make in diet to have a good and healthy skin?
Well, I mean, it's the same thing that people have been telling you for probably 50 years. Or not 50 years, but more recently. But this is known for the last 50 to 100 years. It's the same kind of a Mediterranean diet is probably the most healthy diet for most people. And unfortunately, most Indians don't adopt that diet. So it's hard for me to tell you in Diwali time the diet that you should have. But the diet that you should have probably is one that is relatively low in inflammatory foods like rice and breads and rotis and jalebis and laddu and things that you all love to eat right now is very highly inflammatory. It's inflammatory for the skin, it's inflammatory for the body, it's inflammatory for psoriasis, for eczema, everything. So people don't like to hear this from me, but that's basically one of the first things. So a diet that's more full of complex carbohydrates, fruits and vegetables. The same thing your mother told you, the same thing I'll tell you, the same thing everybody will. Fruits and vegetables are complex carbohydrates, limiting your meat intake. And for those of you who really want to learn about meat, and most of you are vegetarian, but those of you who really eat meat, you want to watch a special on Netflix called Forks Over Knives. You need to watch it and learn it, because once you learn it, you will understand that the eating of most meat products is probably not a good thing. An occasional fish here and there is probably okay. Chicken is actually not that great. And beef, obviously, which most of us don't eat, is terrible. Pork is the worst meat. And lamb is probably not great either. But an occasional, having it because it tastes good is probably okay. But a predominantly plant-based, complex carbohydrate diet, low in liquor, maybe a little bit of red wine, is probably the best diet. It's the anti-inflammatory and healthy skin diet. And you can add in some supplements, vitamin D, fish oil. For eczema, evening primrose oil may be effective. That's a supplement you can get. These are small things. And again, I've like I said, I have a file of natural things I need to make a lecture about. And
let me ask you a related question, which came up from one of our medical practitioner, Dr. Padma Srinivasan. She's asking, what about apple cider vinegar or yogurt for scalp dandruff?
Never heard of it consistently working. I mean, you can try it. Apple cider vinegar, it's very acidic and maybe a bit irritating. Yogurt, you could probably use it before you take a shower. It'll probably lift up some of the flakes. I don't know what studies have ever been done on yogurt. Yogurt is good in a dietary way, but the other thing that Forks Over Knives does not like is a large amount of milk products, because milk protein is very inflammatory. So that's another bad thing. So many of you love yogurt, you want to limit the intake of yogurt.
So in your prescribed set of diet, how does dairy product figure in? Does it figure in, or it's just
it's much less dairy product. So human beings were not meant to drink cow's milk. That's what we were meant to do. the protein in cow's milk called casein is highly inflammatory. So you really need to limit it to, as you know, what maybe a limited amount. It's not that you should completely eliminate it, but when children are weaned from breast milk, if they go right to formula or cow's milk, it used to be cow's milk. Formula is probably not great either, but it's an issue that we need to address. That milk by itself is pretty inflammatory, and people have noticed, at least my patients have noticed, that those especially the ones who have eczema or psoriasis as adults, go onto this plant-based diet and actually lose weight, do significantly better. They improve. They absolutely improve.
So that's a great session so far, Dr. Dhawan. Thank you so much.
Thank you.
Once again, very interactive. We covered a whole bunch of new areas. It was a deep dive on so many things in such a short time. This is excellent.
Thank you.
And before we, sort of call it off today, any other questions? Very quick questions. Somebody want to raise a hand? We just have 1 minute to do that. If the last question, anybody, otherwise we'll close. And of course, there's a sigh of relief by one participant who says, no more chai for hubby because of your dairy, your prophecy on the dairy product. So, yeah.
Yeah, I mean, I'd cut back dairy, absolutely. If you can. I mean, I drink a little bit of milk every day, but it's much less than I used to after watching Forks Over Knives. And there's a book by a doctor, I'm blanking on his name right now, Michael something or the other, I have it. It's called How Not to Die. I'd read that book too. It's a great book. I've read parts of it. It's quite well written. Forks Over Knives in that book.
We do a lot of these sessions on diet, yeah, and that's something that we have been trying to present very scientifically, very data-driven.
Yeah.
The fact that the cow milk is the calcium that the cow gets is all from the plant and it's not manufactured there. So that's something fundamentally wrong notion that we carry. So yeah.
Yeah, and casein, which is the protein in cow's milk, is a problem too. So these are all issues, but that doesn't mean you completely cut it out, but you cut it back. You be very careful.
Right. So that's all we have for today.
Thank
you. We will. I think the two videos that we're going to have, part 1 and part 2, is a rich repository of everything one needs to know in a very succinct manner on skin. So thank you very much.
Thank you
for contributing to this knowledge base of Crack the Wellness Code.
And
we'll be in touch with you, Dr. Dhawan. And thanks to all the participants for being with us. We know there's a festive season on, so it's really, really laudable for all of us to have you here. So thank you, and we'll be in touch.